to go ahead and wash my hands and we can get started. All right, so I'm going to provide for privacy by closing these blinds, or this curtain. Okay, so we're going to do a physical assessment today. Can you tell me your name?
Summer.
Okay, and where are you right now?
Hospital.
And what's today's date?
January 17, 2016.
Okay, all right, perfect. So my patient, she is oriented times 3. Can I check your wristband? Okay, and her name is Summer. So, her posture is upright and her hygiene is good. Her speech was in good quality and it was appropriate. Okay, so now we're going to start with the ears, eyes, nose, and throat. Okay, so we're going to start with your facial sensations. Can you squint your eyes for me? Okay, and raise your eyebrows. And smile real big. Puff out your cheeks. Alright. Okay, now close your eyes. And I'm going to touch your face, and you just tell me where I touched.
Forehead. Chin. Nose. Cheek. Cheek.
Okay, so she has sensation in her face. Okay, so now we are going to start with the ears. Okay, there is no redness or discharge of the ears. Now what I'm going to do is I'm going to do a whisper test. I'm going to whisper something in your ear and then you just say back whatever I said.
Chicken. Noodles.
Okay, I said chicken noodles and she heard me. Okay, so now I'm going to do the eyes. I'm going to have to shine a light in your eyes. It's not going to be the most comfortable thing, but can you look forward for me? Okay. So right now I'm just taking a look at her eyes, and her pupils, they are round and they are equal. Okay, they are also reactive to light. Okay, keep looking forward. Look at my finger. Okay, and they also accommodate. So that's good. There's no redness or discharge of the eyes as well, so they're good. Now we're going to take a look at the nose. Okay, there's no redness or discharge coming from the nose. Can you sniff the other nostril? Okay, and her nasal patency is intact, so that's good. Now we're going to take a look at the mouth. Open and lift your tongue. Okay, so her mucous membranes, they are pink and moist. Her teeth are in good quality and good hygiene. There's also no visible abnormalities under her tongue, anything like that. Okay, so her face is done. Now we're going to go to the chest and the lungs, or the thorax and the lungs. So, just looking at her, her thorax is symmetrical, and she also has a 2-to-1 ratio of her abdomen. Okay, can you turn around for me? Or 2-to-1 ratio anterior to posterior. Okay, so now we're going to take a look at her spine. Her spine is straight, there's no abnormal curvature. And now we're going to listen. Okay, so when I place my stethoscope, just take a deep breath. Okay, And the front. Okay. All right, so now we're going to listen to the front. Okay, perfect. So her breath sounds, they were equal. They were of moderate depth and, sorry about that. Okay, so they were equal, they were of moderate depth, and I didn't hear any stridor, crackles, wheezing, anything abnormal with her breathing. Okay. So now we're going to go ahead and we're going to do your blood vessels and your heart. Okay, so the first ones I'm going to palpate or feel is your carotid. We're going to do one at a time. Okay. Okay. It's probably going to be a little bit hard to see if I don't pull that down. Okay, now we're going to do the radial. Just right by the thumbs if you can't see. Okay. Now the brachial. Can you put your arms up for me? Brachial. Okay. Now we're going to do the posterior tibial. Okay, and now we're going to do the dorsalis pedis. The very top of the foot. Between the big toe and the long toe. Okay, pulses are all equal and they're 2+. So that's good. And now we're going to do the heart sounds. Okay, so first I'm going to start. Okay, can you sit up straight for me? Okay, so first we're going to start with aortic. Okay, it's going to be the right intercostal, the right second intercostal space, right of the sternal border. Okay, next is going to be the the hominid in the second intercostal space, left of the sternal border. Okay, next is going to be the Erb's point, third intercostal, left of the sternal border. Now we're going to go to the tricuspid, which is the fourth intercostal space, left of the sternal border. Alright, and now we're going to do the mitral, which is the fifth intercostal space at the mid-clavicular line. Okay. Great. So the heart rate and rhythm was equal, and it was good. And now we're going to do the GI. So can you lay down for me? Okay. Lay kind of flat. Okay. So now what I'm going to do is I'm going to take a look at her abdomen. Her abdomen is flat. Her abdomen is flat. There's no protrusion. Okay, so now I'm going to take a listen. And I'm going to first listen to her right lower quadrant. Okay, now I'm going to listen to her right upper quadrant. Her left upper quadrant. And her left lower quadrant. And her bowel sounds are normal active. And now I'm going to percuss. Oh, or palpate. Okay. Do you feel anything? Let me know if you feel anything at all. Okay, so she has no pain or tenderness. Okay, so when was the last time that you had a bowel movement?
Yesterday.
Okay, and was it normal? Yes. Okay, so there's no pain and her last bowel movement was yesterday and it was normal. Okay, how about when was the last time you went pee or when was the last time you urinated? Okay, and was there any pain or any abnormalities to it? Okay, so everything is normal? Okay, perfect. So everything is normal there. All right, so I'm going to check her skin and see if she has any edema, swelling, any lesions, anything out of the ordinary. And I'm also going to check her capillary refill. Okay, so I'm going to check the capillary refill of her toes. Okay, and that's less than 3 seconds. There's also no abnormal swelling or edema, which is good. I'm going to check your capillary refill of your fingers. That is also less than 3 seconds, and her skin is warm to touch. No visible lesions or anything significant that I can see. Okay, so can you sit up for me? Okay, so stick your arms out. Okay, now I'm going to press down on your arms and just resist me. Okay, now I'm going to push up. Okay, good. Now put your arms out like this. I'm going to push against you. And I'm going to pull and you just pull. Okay, good. Okay, now we're going to do legs. Okay, push against me. And again. Stick your legs out. Resist. Push. Awesome. Okay, so now we're going to wiggle our fingers, wiggle our toes, move our wrists, move our ankles. Okay, hands behind the back, hands in front of the chest, up in the air. Awesome, great. Okay, so now can you stand up for me? Walk to the table. Walk back. Close your eyes. All right, so her gait was smooth and steady. She has balance when closing her eyes, so that's really good. Okay, so can you sit down for me? All right, so I think we're done now. Do you need anything? Are you in pain? No? Do you need anything to drink or anything? Okay, well, here's your call bell. If you need anything, just push it and I will be here. If not, I'll be back in an hour to check on you. Okay, so I'm going to go ahead and document my findings and we are done. Oh, I'm going to also wash my hands. All right, and we are done.